Good morning, and welcome to the June edition of ITMG's 2020 Informational Webinar Series. My name is Lana Hunt, and I am the Director of Training and Outreach with ITMG. June is Alzheimer's and Brain Awareness Month, and this webinar provides an opportunity for ITMG to help to bring awareness to the fact that Alzheimer's disease and other dementias are the only leading cause of death that cannot be prevented, cured, or even slowed. Worldwide, 50 million people are living with Alzheimer's and other dementias, and so we are joining with the Alzheimer's Association in going purple and raising awareness by sharing information on brain health and aging. Today's information will be shared by ITMG's RN consultant, Laura Dieter, in partnership with the Administration for Community Living and the National Institute on Aging. Before I introduce Nurse Laura, I would like to remind everyone that today's webinar is being recorded, and the recording, along with additional resources, will be available on ITMG's website at go-to-itmg.com in the resources section within 2 business days. All attendees will receive a follow-up email also within 2 business days that will contain a link to download an attendance certificate that can be used for continuing education credit. So I would like to take a moment now to introduce Laura Dieter. Laura graduated from St. Elizabeth School of Nursing in 2005, and she has worked in the fields of medical surgical, cardiac critical care, and emergency nursing. She has also worked as the operations manager for a hospitalist group and has managed a small health clinic focusing on preventative care and disease management. Laura started her position as ITMG's nurse consultant in January of 2018, and I'm very pleased to welcome her as our guest speaker for today's information. Laura, you may start your presentation.
Thank you, Lana. Good morning, everyone, and thank you for joining us today. As Lana mentioned, I am Laura, the nurse consultant, and I'm going to be talking today about how we can protect our brain health as we age and those factors that pose a risk to not only our overall health, but our brain functioning as well. So our brain is a complex organ that controls literally everything we do, from talking to walking, and aspects of our thinking, such as remembering, planning, organizing, decision-making, and more. These cognitive abilities affect how well we do our everyday tasks and if we can continue to live independently. So changes in our thinking are common as we age, even in healthy adults. So changes in memory and learning include challenges with multitasking, increased difficulty finding words, and a minor decrease in our ability to pay attention. Aging, though, can also have positive cognitive changes. We're typically more knowledgeable as we get older and bring more life experiences to the table. Our brain also remains plastic, which means it's able to adapt to new challenges and tasks. So we can still improve our skills, learn new things, create new memories, and improve our vocabulary. We know and can physically see how our bodies change as we age. Gravity seems to pull a little more, wrinkles start showing up, and gray hair starts sprouting up everywhere. But the changes in our brain aren't quite as obvious. So certain parts of our brain shrink, especially those that are important to learning and other mental activities. Certain areas of our brain, the communication between the nerve cells can be reduced, and due to chronic conditions such as heart disease and diabetes, our blood flow to the brain can also decrease and the inflammation can increase, and all of that leads to changes within our brain. We can protect our brains as we age by maintaining our overall health. Preventative care is a big factor in how we age. So we want to strive for healthy eating, regular exercise, keeping our brain active, staying connected with friends and family in our communities, and getting enough sleep. Healthy eating is probably the biggest factor in maintaining our health. What we eat affects how we feel, look, and age. The American diet has shifted away from a mostly whole food diet to one that is now highly processed, high in calories, fat, and salt. 1 in 4 Americans eat out every day, and our health is taking the hit. Obesity rates in both children and adults are at an all-time high, with more than 1/3 of adults falling into the obesity category. So not just overweight, but falling into that obesity category. 17% of children aged 2 to 19 are now considered obese. And we have never in history seen children be at this rate of obesity before. So we really need to shift back to a whole food, plant-based diet, which is the only diet that's scientifically proven to prevent and reverse chronic health conditions such as heart disease and diabetes. So we want to focus on eating and drinking less sugar, salt, and solid fat. I read that Americans consume almost 3 pounds of sugar per week, which is insane. Make fruits, vegetables, and whole grains a major part of your diet. Choose lean meats, fish, or poultry. Choose low or non-fat dairy. Control your portion sizes, and most importantly, know what your portion sizes are. I think that's where most of us slip up, is not knowing what a portion size is. And drinking adequate fluids. Science now is saying that we should be drinking half of our body weight in ounces in liquids a day. So calculate that out for yourself and try to hit that goal each day. And lastly, we want to just eliminate that processed, prepackaged foods from our diet. There's typically no nutritional value in processed, prepackaged food. Area agencies on aging offer a range of services, including home-delivered meals for adults 60 and older. So if you or someone you know does not have access to healthy food, this is a good resource to look into them for them. Staying active has also been proven to help maintain our overall health. It not only controls our weight, but it also can help our heart and circulatory health, and can help prevent and control other diseases such as diabetes, heart disease, depression, and stroke. It can also help prevent falls. 1 in 4 individuals age 65 years of older fall each year. And falls are a major threat to independent living and increase our risk of early death. And we'll talk about falls a little bit later. Exercise can also improve connections among our brain cells. Evidence indicates that being more physically active is associated with a lower risk of Alzheimer's disease and a slower rate of cognitive decline. One theory behind that is that exercise prevents the buildup of plaques and tangles that are the hallmark of Alzheimer's disease. Another theory is that being more active improves or maintains the brain's ability to function in spite of that accumulating damage that occurs in Alzheimer's disease. So things that we can do is talk to our healthcare provider to see what activities are best for you. Make sure that you take that opportunity to discuss any restrictions or limitations that you may have, depending on illnesses you have or surgeries you've received in the past. All of that can limit some of your activity, so just know what that is. And also join programs that teach you to be active safely. Most gyms and community centers or fitness centers have classes geared specifically towards the aging population. And we want to move our bodies 4 to 5 times a week, about 30 minutes each day. Again, I read a statistic that said almost over 80% of Americans do not meet that requirement. So really aim to hit that, just moving your body, even if it's just to get out for a walk or do a little bit of weightlifting or strength training in your home. It doesn't have to be in a gym or at a fitness center. You can do plenty of activity at home and for free. And we also want to work to keep our brain active, exercise our brain, not just our body. So when we learn new things, we engage our brain. So we can find hobbies or activities that we haven't done before, such as reading new genres of books or magazines, playing games, taking classes or joining a club, trying new recipes, or keeping a journal, learning to dance or learn a new language or play an instrument, volunteering in the community, or just research something that you're interested in. So the goal is just to choose things that you enjoy and include in a variety of activities that exercise different parts of our brain. As I said earlier, our brain remains plastic, so we can continue to learn new things. So staying connected with others can also be protective of our brains. Dr. Cole from the University of California focuses his research on understanding how loneliness affects our minds and body and how we function. He found that loneliness acts as a fertilizer for other diseases. The biology of loneliness can accelerate the buildup of plaque in arteries, help cancer cells grow and spread, and promote inflammation in the brain, leading to Alzheimer's disease. There's another study done by Robert Waldinger. He's the director of the Harvard Study of Adult Development. And this is a study that's been going on for about 75 years. And they took individuals from different socioeconomical classes and studied how they aged. And they started when they were teenagers, and now these individuals are now in their 80s and 90s. And they found that they could predict how someone would age by looking at how happy and satisfied they were in their relationships in their earlier years. So they found that those that were most satisfied at age 50 with their relationships were the happiest and healthiest at age 80. It also helped to protect their brains. So those, again, who were most happy and satisfied in their relationships were less likely to have memory problems or develop Alzheimer's or dementia. So there's a whole TED talk that I've shared before, but it's called What Makes a Good Life. And if you're interested in that, I would highly recommend you watching it. It's only about 12 minutes, but it was really interesting. So we can counteract all of that by being social and staying connected, by volunteering and working, joining clubs or gathering with friends and family, or trying programs at the local community organizations. And if you know somebody in your community that may not have access to those situations, reach out to them and spend time with them. And that's going to go a long way to helping them feel a little bit more connected to the community. We know that we can age well by, we know that we can age well both physically and mentally, but there are also risks to watch out for as we age. Some of these include accidents, alcohol, smoking, certain medications or the improper use of medications, and certain chronic health conditions. So if you ask any older adult what their biggest concern is, most likely falling is going to probably top that list for good reason. Falls are the leading cause of both fatal and non-fatal injuries for people at 65 years of age and older. In fact, more than 56,000 seniors are hospitalized each year as a result of head injuries due to falls, and 8,000 of those individuals will die as a result of those falls. So we can reduce our risk by exercising, which will improve our balance and coordination. We can wear our safety belts and helmets, take fall prevention classes. The area agencies on aging offer evidence-based fall prevention programs that help older adults reduce their risk of falling. So you can use that resource to find classes located near you. Make sure your home is safe. 30 to 50% of falls are due to environmental causes. And the National Institute on Aging reports that 80% of those falls occur in the bathroom. So just some simple things that you can do to help make your home safer is remove tripping hazards such as throw rugs, increase the lighting throughout the house, especially in well-traveled areas. Make your stairs safe by adding a second handrail going up the stairs, adding grab bars in the bathroom by the toilet and in the shower, non-skid mats in the bath and shower and outside so you're not stepping on tile, a handheld shower head, and even a shower seat in the bath. So you can also review medications with your healthcare provider. A lot of medications have a side effect of drowsiness and dizziness, so just be aware of those medications and how they can affect you. Have your vision and hearing checked, and get enough sleep. I don't know about you, but when I'm tired, I'm more likely to have accidents and do silly things that I wouldn't normally do if I've gotten enough sleep. Alcohol is another risk to our brain health. As people age, we become more sensitive to alcohol's effects. So the same amount of alcohol can have a greater effect on an older person than that of someone who is younger. So we all know how alcohol can affect us. It can impair our communication among our brain cells. It can cause drowsiness, dizziness, fuzzy memory. If used or abused long-term, it can have impacts on our balance, coordination, memory, and emotions. And it can also be dangerous when mixed with certain medications. If you look, alcohol is almost always contraindicated with the majority of medications. And it's important to note that it can have interactions with both prescribed and over-the-counter medications. I think we all have a little false sense of safety with over-the-counter medications, but just know that that can be a reaction with over-the-counter medications as well as prescribed. Alcohol can also compound the side effects like drowsiness, dizziness, and fatigue. So we can reduce our risk by avoiding alcohol altogether, or following the dietary guidelines for Americans, which describe moderate alcohol drinking as up to 1 glass a day for women and two a day for men. Smoking is a major threat not only to our overall health, but to our brain health as well. Smokers are more likely to develop heart disease, stroke, lung cancer, and type 2 diabetes. There really is no way around it. You have to quit smoking. It's going to be the biggest thing that you can do to help you age well. Quitting smoking can lower your risk of heart attack, stroke, and lung disease. According to the CDC, by 1 year after quitting smoking, your risk of heart attack drops significantly. Within 2 to 5 years after quitting, your risk of stroke is the same as a non-smoker. In 10 years after quitting, your risk of dying from lung cancer drops in half. So again, quitting smoking is going to be a major factor in aging well. So we also need to look out for other types of air pollution, such as from fires, vehicles, industrial areas. Candles are another one that we don't give a lot of thought to. They've recently kind of come out about the toxins that can be released in the air when you burn a candle. So make sure you're using those limited and using those in well-ventilated area. Chemicals in cleaning supplies are also something to take into consideration. Again, make sure you're using a well-ventilated area, open a window, turn on the vent fan when you're cleaning the bathrooms to prevent from inhaling those chemicals directly into your lungs. Excuse me, medicine, while sometimes necessary, can also put our brain health at risk. The way we metabolize medications can change as we age, and as a result, reactions to those medications can change as well. 80% of older adults have at least one chronic health condition, and those health conditions can complicate the side effects of medications. So we want to talk to our healthcare provider about both prescription and over-the-counter drug interactions. Again, we tend to not list our over-the-counter medications. There are supplements when talking to our providers. So we want to make sure that we include those when we're talking to our doctors about the medications that we're taking. Over-the-counter drugs can interact with prescription drugs as well as have other side effects that you may not be aware of. You want to talk about memory and brain function side effects that the medications you're taking can have. In 2015, the National Academy of Medicine published a report listing groups of medications that can affect older adults' cognition. These groups include antihistamines, anti-anxiety and depression medications, sleep aids, antipsychotics, muscle relaxants, and antispasmodics, some of which are all sold over the counter. So again, knowing what those side effects are is very important. And you also want to know whether your medications can affect your sleep. We'll talk about sleep here in just a minute, but sleep can have lack of sleep can have a major impact on your overall health as well. And it's also important to know your dosing instructions and, again, the side effects of your medication. So as mentioned, 80% of older adults have at least one chronic health condition. So those most common conditions include heart disease, stroke, high blood pressure, diabetes, and sleep problems. So it's really important to prevent and treat for these conditions, not only for your body, but for your brain's health as well. Heart disease, stroke, and high blood pressure can all have lasting damage to our bodies and brains. An estimated 1/3 of all cases of dementia can be attributed to vascular factors, according to Dr. Albert Hoffman of the Harvard School of Public Health. The buildup of fatty plaque and the stiffening of arteries as we age both contribute to heart disease. These processes can also damage the brain's function by interfering with the steady supply of oxygen-rich blood to the brain. In the case of a stroke, brain tissue dies when the blood clot cuts off the blood flow to the brain. In addition to the immediate damage from the stroke, roughly 1 in 3 stroke survivors will eventually develop dementia. So we can reduce our risk by managing our cholesterol, controlling our blood pressure. So a normal blood pressure is a systolic pressure, which is your top number, of less than 120, and a diastolic pressure, which is your bottom number, of less than 80. In the last few years, we've cracked down on the definition of high blood pressure. You used to not be diagnosed with blood pressure until your top number was greater than 140. And we've actually lowered that down now to 130 to 139. You're now considered stage 1 hypertension. And we've done that so that we can catch it early and we can start treating it early so we don't end up with this cascade effect of damage to the body and the blood vessels. We also want to eat healthy, quit smoking, limit our alcohol, and limit that exposure to air pollutions. So diabetes is another chronic health condition that can affect nearly every part of our bodies, including the heart, kidneys, blood vessels, nerves, and eyes. Diabetes increases your risk of heart attack and stroke, memory problems, and Alzheimer's disease. With diabetes, you have an increased risk of damaging the small blood vessels in your brain, which in turn affects the brain's white matter. White matter is the part of the brain where our nerves talk to one another, and when that is damaged, you can have what's called vascular cognitive impairment, which is changes in our thinking. Those with type 2 diabetes are at a higher risk for that, and the longer you have diabetes, the higher your chance of developing dementia. Because diabetics typically have other comorbidities or other illnesses such as high cholesterol, high blood pressure, high triglycerides, it's really important to control your blood sugar levels. And we can do that by maintaining a healthy diet and a healthy weight and talking to our healthcare provider about the medicines we can take to help control that blood sugar if we're not able to do it through diet and weight management. I would also encourage you to have yearly labs drawn, including a hemoglobin A1C, which is a lab that gives you an average level of your blood sugar over 3 months. It's going to give you a really good picture of how well your blood pressure or your blood sugar is being controlled. It won't go through all the different ranges, but a 6.5% or higher categorizes you as a diabetic. Diabetics typically want to aim for 7% or less. That is just kind of where we draw a line in saying where this is where the blood sugar is being controlled. A higher number of a hemoglobin A1C gives you a higher chance of complications related to diabetes. So there's an abundance of research suggesting that sleep problems may contribute to cognitive impairment and memory loss later in life. In fact, people with insomnia were twice as likely to develop dementia over a 3-year follow-up study than those without. So there are numerous ways that disrupted or disordered sleep can cause problems in memory and cognition. Sleep is required for memory consolidation, so missing out on sleep can actually interfere with forming memories, which is fascinating to me. Sleep deprivation can increase the amyloid B concentrations in your body. This is what forms amyloid plaques, and these are the hallmarks these are the markers for Alzheimer's disease in the brain. Sleep problems can cause disruption in circadian rhythms and the hormone melatonin, which are both important for cognitive function. And sleep disorders like sleep apnea can actually cause a lack of oxygen while you sleep, which can damage the brain. So what happens in sleep apnea is you actually stop breathing. So you decrease the oxygen going to your brain, and then your brain sends a signal to your body to wake up and take a deep breath. This all happens without you really even realizing it. If you sleep in the same room with someone, they probably tell you that you are a loud snorer. So you usually wake up very tired. That's probably the first indicator that people have sleep apnea, is that they have that daytime fatigue and never feel like they get a good night's sleep. Sleep apnea can also lead to high blood pressure, heart disease, daytime fatigue, as I said, diabetes, metabolic syndrome, and liver problems such as non-alcoholic fatty liver disease. And insomnia can also cause depression, which can in turn impair cognition. So lack of sleep is a big, big factor in aging and staying healthy. It's not just that you're not getting enough sleep. It can have lasting damage on the body. So what we can do is aim to get 7 to 8 hours of sleep each night. You want to talk to your healthcare provider or a sleep specialist if you are having issues sleeping. If you are diagnosed with CPAP or with sleep apnea, you'll be given a device called a CPAP, and it's very important that you use that as prescribed. You want to quit smoking. Nicotine contains a stimulant that's going to help keep you awake. And you can try relaxation techniques such as deep breathing or meditation to kind of help slow you down at night and get you ready for sleep. So dementia is a general term used to describe a general decline or a decline in mental ability severe enough to interfere with daily life. Alzheimer's is the most common form of dementia. Known risks for dementia include age. We're at a higher risk as we get older. Genetics, there is definitely a genetic component in who develops dementia and Alzheimer's. Head injury, those with a moderate TBI had a 2.3 times greater risk of developing dementia, and those with a severe traumatic brain injury had 4.5 times more likely to get dementia, according to the National Alzheimer's Association. And again, stroke, as I stated earlier, 1 in 3 stroke survivors will eventually develop dementia. While symptoms of dementia can vary greatly, at least 2 of the following core mental functions must be significantly impaired to be considered dementia. So memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. Exercise, healthy diet, controlling our blood pressure, controlling those chronic illnesses that we have, and our cognitive brain training are all approaches that have been shown or that are showing promise in reducing the risk of cognitive decline or dementia, but need more testing. There is no cure for dementia. So I know that all of this can be very overwhelming and kind of hard to take in, and I don't want it to feel insurmountable. It is important to take control of your health today, and you can do that by just starting small, but start. The first step should be scheduling an appointment with your primary care physician if you have not had a yearly checkup done recently. So we want to focus on preventative care. So if you don't have a primary care doctor, that should be your first step. Schedule an appointment, schedule those yearly labs, review the labs with your physician. Those appointments are usually scheduled 40 to 60 minutes, so use that time. Don't just rush through the appointment just to get it over with. Use that time to go over those labs, know your numbers, review your health risks with your provider, review your limitations so that you have all of that information when you leave that appointment. You also want to use that time to review your medications with your healthcare provider. And I can't stress enough to know your medications. If you're taking them, know why you're taking them, know what dosage you're taking, and again, include those over-the-counter or supplement medications that you're taking as well. You don't have to memorize it, but keep it written down so that it's handy for you to have. With your diet, start small and build on each step. So maybe it's adding a vegetable to your diet, or maybe it's trying to drink enough water, or cutting out some of the fast food that you're eating, or making more meals at home. But add something each week. Start with one thing and continue that habit and add a new habit, and eventually your diet will change. Trying to overhaul everything all at once is going to be overwhelming, and you're probably going to throw in the towel. So start again small with one small task that you know you can achieve, and then build your way from there. If it's helpful for you for accountability, you can start a food or activity or a health journal. And lastly, just find your community resources. See what activities are offered and programs that are offered so that you can stay connected socially, keeping your brain active with different classes and activities, and just being out there in the community. We know that staying social is going to help us age well. And if you want more information on this, please visit any of these resources listed below here. And that concludes my presentation today. And I want to thank you all for joining me. And I hope you learned a little something today on how you can keep your brain healthy throughout your lifespan.
Thank you, Laura. The information was very helpful. And as Laura mentioned, the resources that you see on your screen are excellent resources for you to access and find information that can benefit you your family members, or the individuals that you're working with. We all have those needs as we age, and accessing information is the first step into helping us all age in a much healthier way. So we do appreciate you participating and attending our webinar today. You will be receiving, when the webinar ends, a short survey, so please take a moment to fill that out. We always welcome your feedback, and we do use that feedback as we are planning additional informational webinars. And as a reminder, you will be receiving an email within 2 business days that includes the link to access today's information, including the recording and the materials that were presented. And then you will also receive an attendance certificate that you can use if you are using this for continuing education. So thank you very much. I hope you have a great day, and I look forward to talking with you at our next informational webinar, which will be held in August. So please look for that information to come soon. And thank you again, Laura, and everyone have a wonderful day.